Dear students, welcome back. In the previous session, we have seen the lumbar typical vertebrae as well as atypical vertebrae. Now, in this session, we are going to see the attachments and some of the relations of lumbar vertebrae. So, first we are going to see the body and then the vertebral canal and then the vertebral arch. So this is the arch, vertebral arch, and the attachments to the transverse processes. Okay. Now, the first one we are going to see is the body of the lumbar vertebrae, and this body is having the upper surface. Of course, this is the superior surface of the lumbar vertebrae, and below this, inferior to this body, will have the lower surface. So this upper surface and the lower surface of the body is related or lie in contact with the intervertebral discs. So discs are attached on the upper surface as well as the lower surface of the body of the lumbar vertebrae. Okay. Now, the upper border and lower borders. So here you can see this one is the upper border. The upper border and the lower border of the lumbar vertebrae gives attachment to the anterior and posterior longitudinal ligaments in front and behind. So this is the front. So you can see here this green part is the anterior longitudinal ligament. On the posterior side we'll have the posterior longitudinal ligament. So this is anterior and posterior longitudinal ligament. If you can see in the entire vertebral column, the anterior longitudinal ligament is present here and the posterior longitudinal ligament is present behind the bodies. Okay, so this one is the posterior longitudinal ligaments. So the upper and lower borders give attachment to the anterior and posterior longitudinal ligaments in front and behind the body respectively. Now we are seeing only the body. Okay, so in the front you'll have the anterior longitudinal ligament and the posterior side of the body will have the posterior longitudinal ligament. Okay. Now, so this is the attachments of the anterior and posterior longitudinal ligaments. So on either side, we can call it as lateral to the anterior longitudinal ligament will have the right crus of the diaphragm, which is attached to the upper three vertebrae, and the left crus of the diaphragm to the upper two vertebrae. Okay, so how many lumbar vertebrae are there? There are 5 lumbar vertebrae, isn't it? So all the vertebrae is having the anterior longitudinal ligament as well as the posterior longitudinal ligament. If you see, this one is the right side and this one is the left side. So lateral to the anterior longitudinal ligament, that means this is right lateral and left lateral. So this part is the crus of the diaphragm. So if you refer the origin of the diaphragm will have the crural fibers, right fibers as well as the left fibers, isn't it? So in that right crus of the diaphragm is attached to the upper three vertebrae, that is L1, L2 and L3. Okay, on the right side, the right crus is attached to the 3 lumbar vertebrae, whereas on the left side, this left crus of the diaphragm is attached to the only upper 2 lumbar vertebrae, that is L1 and L2. Okay, so this is the attachments of the crus of diaphragm to the body. Okay, now behind the line of the crura, The upper and lower borders of all lumbar vertebrae give origin to the psoas major muscle. So if you can see, this is the psoas major muscle, that is behind the line of crura. So that means here behind the line of crura, behind the crus, you will have a muscle attachment which is very important muscle, that is called as psoas major. So which is present anterior to the transverse process. Still the muscle is present anterior to the transverse process, but this muscle is attached to the body of the vertebrae. That means this much part is going to attach here. The muscle is the psoas major, so it is giving origin to the psoas major muscle. Okay, now, and across the constricted part of the body on either side, tendinous arches are attached. The lumbar vessels and the gray ramus communicants from the sympathetic chain pass deep to these arches. Here if you can see, so this is the body, and we'll know this, what is that, pedicles, isn't it? And over this, that is the constricted part where of the body, where this lumbar vessels and some of the tendinous arches, the gray ramus communicants from the sympathetic chain will pass deep to these arches. Okay, so these are all the attachments and relations to the lumbar body. Okay, so here you can see the tendinous arches. So where all these lumbar vessels and gray ramus communicants from the sympathetic chain pass deep to these arches. Okay, so this constricted part is present both on either side. Next, coming to the vertebral canal. So the vertebral canal is this thing. The vertebral canal is in triangular in shape here, and this canal is formed by the part of the vertebral canal. That means all lumbar vertebral canal, all 5 lumbar vertebrae foramens unite to form the lumbar part of the vertebral canal. The part of the vertebral canal which is formed by the first lumbar vertebrae. That means here if you can see, this is the first vertebral canal, first part of the vertebral canal. So here this is lodging one important structure called as conus medullaris of the spinal cord. That is the tip of the spinal cord. So the spinal cord is going to end up at the level of L1. So the L1 part of the vertebral canal lodges this conus medullaris. Okay. The part which is formed by the lower 4 lumbar vertebrae contains the cauda equina. So you can see this cauda equina, a bunch of nerves which are descending down, which are going to supply the lower part of the body. Okay, so this tail portion, so it is called as cauda equina, tail portion of the spinal cord is present in the remaining 4 parts of the lumbar vertebral canal. Okay, and all these lumbar vertebrae also contains the spinal meninges. That means the coverings of the spinal cord. It is not only end up at the tip of the conus medullaris, but still the meninges are present till at the end of the vertebral canal. Okay, so this is about the vertebral canal here, which is formed by all the 5 lumbar vertebrae. In this, L1 part lodges the conus medullaris and the remaining 4 lodges the cauda equina, and also the spinal meninges are present. Now, coming to the vertebral arch. So here the arch is normally called as the posterior part. Okay, so here this is the entire portion is called as the vertebral arch. So here in this vertebral arch, the pedicles, laminae and the spine forming the vertebral arch. From this you'll get this transverse processes and the articular facets. So this arch, how this arch is related to the structures, or any attachments are there with this vertebral arch. Now we know that these are the pedicles here. So these are the pedicles. Yes, this one is pedicle. So the pedicles are related above and below the spinal nerves. So because these pedicles forms the vertebral foramen, isn't it? The intervertebral foramens are formed by these pedicles. Yes, superior one is less less depth here, because it is originating from the upper portion of the vertebral body. When you see at the lower portion, it is somewhat depth, because it is having some gap behind the vertebrae. So if you can see, this is the body of the vertebrae. So here you can get this pedicles, but this lower part is empty. And again you will have this intervertebral disc, and again the body, again this pedicle. So here, and you will have the arches here, and this is the articulating facet. So superior articulating facet and inferior articulating facets are articulating here, and here it forms a foramen. So through this foramen, the spinal nerves are coming out. So here you can see the spinal nerves are coming out in this pic. So again the same way. So here this is the lower portion. If you have any vertebrae above, then again here this is the pedicle, and it is articulating with the facets. Again you will have the foramen. Again here the spinal nerve is coming out. That means it is related above, the pedicles are related with the spinal nerves above and below this pedicles. Okay. Now coming to the laminae. So the laminae provide attachment to the ligament called as ligamentum flavum. So the laminae is attached to the ligamentum flavum. So here the laminae, this part, the laminae is attached to the ligamentum flavum. And the spine, if you come to the spine provides attachment to the posterior layer of the lumbar fascia. So it is attached to the posterior layer of the lumbar fascia, and also it is attached to the interspinous and supraspinous ligaments. That means this is one spine of one vertebrae, and this one is another spine of another vertebrae. So in between these two spines one ligament is present, that is called as interspinous ligament, and another ligament called as supraspinous ligament. So the supraspinous ligament is going to attach all the spines of the vertebral column. That means the supraspinous ligament is present on the posterior aspect, which are connecting all the spines of the vertebral column. Okay. and then the erector spinae, the multifidus and interspinous muscles are also attached. Here you can see this multifidus muscle, so it is attached to the spine. Okay, and also the erector spinae, this one is the complex group of muscles combined to called as erector spinae. There is a group of muscles which forms the erector spinae, that we are going to deal erector spinae as a special class. Okay, and the interspinous muscles, that means here spine to spine some muscles are attached, so that muscles are called as interspinous muscles. So the spine provides attachment to the posterior layer of the lumbar fascia, and it is attached, and it is giving attachment to the interspinous as well as the supraspinous ligaments, the erector spinae, multifidus and the interspinous muscles. Okay, and these are all the attachments to the vertebral arch. The vertebral arch includes the pedicle, laminae as well as the spine. So for the pedicle is related to the related upper and lower by the spinal nerves, whereas this laminae provide attachment to the ligamentum flavum, whereas the spine provides attachment to the posterior layer of lumbar fascia, the interspinous and supraspinous ligaments, the erector spinae, the multifidus and the interspinous muscles. Now coming to the transverse processes. So what are the muscles or any other attachments to the transverse process? Now we will see. So here the tips of the transverse process of all the lumbar vertebrae gives attachment to the middle layer of the lumbar fascia. So here you can see this one. Here it is giving attachment to the middle layer of the lumbar fascia. Here the tip of the transverse processes of all the lumbar vertebrae give attachment to the middle layer of the lumbar fascia, whereas the posterior layer is getting attached from the spine of the vertebrae, whereas the middle layer is getting attached to the, so here not the entire thing, you can see here this is the middle layer, so this one is the middle layer. Okay, middle layer of the lumbar fascia. In addition, the tip of the first processes gives attachment to the medial and lateral arcuate ligaments. So if you remember the diaphragm muscle attachments, so the crural fibers, after it is giving origin to the crural fibers, you will get another ligament called as crural ligaments, which are giving attachment to the medial and lateral arcuate ligaments. That means it is giving like this, so two ligaments coming like this, so medial and this one is medial and lateral arcuate ligaments. Okay, and the tip of the fifth processes, so and the tip of the fifth processes, so not the entire vertebrae, but the tip of the fifth process gives attachment to the iliolumbar ligament. So the tip of the transverse processes of the fifth lumbar vertebrae gives attachment to the iliolumbar ligament. Okay, now coming to the other attachment, the faint vertical ridge on the anterior surface. So here you can see this is the faint vertical ridge on the anterior surface of each transverse process gives attachment to the anterior layer of the lumbar fascia. Here you can see this one is the anterior layer of the lumbar fascia. So this ridge is giving attachment to the anterior layer of the lumbar fascia. So this vertical ridge is present on the anterior surface of each transverse processes. Okay. Next, medial to the ridge, the anterior surface gives origin to the psoas major. So already the psoas major is also originating from the body. And if you see this medial part like this, so this is the medial part. So if you can see the medial part of this vertical ridge, so it gives origin to the psoas major. That means the psoas major muscle is originating from the body as well as the transverse processes of the lumbar vertebrae, especially on the anterior aspect. And lateral to the ridge, if you can see lateral to the ridge, this is the lateral part of the ridge. So this one is giving origin to another muscle called as quadratus lumborum. So this one is quadratus lumborum. So if you can see this, so anterior to the transverse processes, you'll have very important muscles, that is the psoas major as well as the quadratus lumborum muscle is present, and behind the transverse process you will have the multifidus and the erector spinae muscles are present. Okay. Now the posterior surface is covered by deep muscles of the back. So here you can see the posterior surface of the transverse processes is attached to the deep muscles of the back. So that is the erector spinae. So we are going to study this erector spinae. This erector spinae is having the superficial layers and middle and deep layers are present. So that means all comes under back muscles only. So in that the deep muscles of the back, and which gives origin to the fibers of longissimus thoracis. Here the longissimus thoracis muscle is one of the part of the erector spinae only, that is the deep muscle. So that deep muscle is originating from the posterior surface of the transverse processes. And also the accessory processes. So here you can see this accessory processes here, that is called as accessory processes gives attachment to the posterior side. You can see this, the accessory processes, so which gives attachment to the medial intertransverse muscle. So that means in between the transverse processes, you'll have the intertransverse muscle, that too medial intertransverse muscle. Okay, and then on the upper and lower borders of the transverse processes provide lateral intertransverse muscles. That means, so it is having medial transverse muscles and lateral transverse muscles. The medial transverse muscles are attached to the accessory processes, whereas the lateral intertransverse muscles are attached to the upper and lower borders of the transverse processes. Okay, so these are all the attachments of the transverse processes. So this transverse processes, mainly it is giving attachment to the fascia as well as the ligaments and muscles. Mainly most of the muscles are getting attached to the transverse processes, and also it is giving origin to the anterior layer of lumbar fascia and the middle layer of the lumbar fascia. and also some of the ligaments, that is medial and lateral arcuate ligaments, especially at the level of the tip of the fifth transverse processes. It gives attachment to very important ligament that is called as iliolumbar ligament. Okay, now we are going to see the articular processes. The articular process, how this articular process are arranged in the lumbar vertebrae, and what are the movements taking place because of this facet arrangement. Okay, is there any muscles attached to this articular process? That we will see now. Yes, the concave articular facets. Here you can see these are the articular facets. So, and this thickened part is called as mammillary processes. So, the anterior aspect to this mammillary process, we will have this actual articular facets. So, which is concave articular facets, which permits. So, normally it is facing towards the sagittal plane. So, the facets are facing in the sagittal plane. So, it permits only some rotation. It permits only some rotation, and it permits more flexion and extension because of this facet arrangement. And the mammillary processes, here the mammillary process gives attachment to the, again if you can see, this is the multifidus muscle and also the medial intertransverse muscles. So here the accessory process, isn't it? Here it is present. This accessory process gives attachment to the medial intertransverse muscle. So some part of the medial intertransverse muscle is also attached to the mammillary processes, and it is also attached to the multifidus muscle. Okay, so these are all the attachments and relations to the lumbar vertebrae. In the next session, we are going to see the applied anatomy which are related to this lumbar vertebrae. And before that, I want to mention the ossification of this lumbar vertebrae. So, it is having 3 primary centers and it is having 7 secondary centers. Okay, so the first we can see the 3 primary centers. So, one for the body, or it is also called as centrum, and one each for each half of the neural arch. So, this is one primary and this one is another second primary, and also this one is the body. So, these are the 3 primary centers of ossification, and this appears in the 3rd month of the fetal life. Okay, and the 2 halves of the neural arch fuse with each other posteriorly during the first year. So, this arch will fuse only after the birth, that is at the first year it is going to fuse. Okay, and the fusion of the neural arch with the body which occurs during the 6th year. So, that means the neural arch, so the 2 halves of the neural arch is going to unite at the first year, and this neural arch with to that of the body is going to fuse at the 6th year. Okay, and the posterolateral parts of the body, so this one, the posterolateral parts of the body develop from the center for the neural arch. Okay, these are all the primary ossifications, and coming to the secondary ossifications, these are having 7 secondary centers. One is an upper annular epiphysis for the upper surface of the body. This one is the upper annular epiphysis for the upper surface of the body, and the similar epiphysis for the lower surface of the body. And coming to the third and fourth secondary centers are one center for the tip of each transverse processes. So that means each tip of the transverse processes, that is the secondary. So now we have seen four secondary centers. One is the upper annular epiphysis and the lower annular epiphysis, and the tips of the transverse processes, each transverse processes. And coming to the fifth and sixth, another two ossifications, that is one center for each mammillary process. Each mammillary process will have the secondary center for ossification, and another one is the tip of the spine. So these are the centers of ossification. So how many centers of ossifications? The primary centers will have 3 ossification centers, whereas the secondary ossification centers are 7. Okay, the 3 primary ossification centers is related to the body and each half of the neural arch. So, and this neural arch is going to fuse, and all these 3 appears in the 3rd month of the fetal life, and after birth only all these primary centers are going to fuse. So the neural arches are going to fuse at the 1st year, and this neural arch is going to fuse with the body at the 6th year. And the 7 ossification centers are upper annular epiphysis and lower annular epiphysis, that is 2, and tips of the each tip of the transverse processes, that means 4 secondary centers are over. And again the mammillary processes, 5th and 6th, 2 centers which are present on each side of the mammillary processes. So on right mammillary process, one center, and the left mammillary process you will have another ossification center, and the last one is the 7th one is the center for the tip of the spine. So this is the ossification center for the tip of the spine. So these are all about the attachments and relations of the lumbar vertebrae as well as the ossification of the lumbar vertebrae. In the next session, we are going to see the applied anatomy related to the lumbar vertebrae. Thank you.